Hi, I'm Dr. David Herman, and I have the honor of being the CEO of Essentia Health, and I'm here in the new Vision Northland building with some of my colleagues. Here we are in the new ED of the new Vision Northland building, and this was designed around the needs of our patients. It's a very busy place, sometimes hectic, sometimes even more than that. So where are we right now, and how does this play into the care that we're privileged to provide every day?
Right now we're in one of our trauma rooms. In the new building, we're honored to have 4 trauma rooms, so we're doubling our trauma space, so that's really exciting, and it's a great new space to provide care in.
When you have a trauma center and you have a trauma space like this, what are some of the things that you care for, and how does the care that we've designed into this room make a difference for our patients?
I think it allows us to be really flexible. So what the patient needs, we're able to deliver in a really seamless way. So we get to utilize all our equipment. It's all right here. We can expand if we have to for whatever circumstance comes our way.
One cool thing is that you'll see that back there's a backward-facing entrance for the ambulances to come in, so that all of the patients up here don't have to see all of the private drama coming in this way.
We find ourselves now in the ED garage. And can you tell me why the garage was designed the way it was?
It was a collaboration between emergency medicine providers, staff, and then also we took a lot of input from our community partners in EMS to design a space that was easy for them to access, get patients in and out quickly. So this is a huge improvement from what we currently have, and will help us care for the Northland in whatever way we need to.
When we design this building, we know that minutes matter, seconds matter in trauma patients. So how close are we to the patients that will come in on the helipad?
So the helipad is a straight shot way up from here. So patients arrive on the roof, and then they'll be able to come right here to the trauma rooms and to the CT scanner, which is right in the department as well, which is a huge advantage in this new space.
This is a level 1 trauma center. Dr. Buehlen, can you tell me what that means?
We're really, really proud to be working at a level 1 trauma center. There's been so much work that's been put into getting us that highest designation. So there is no higher level of trauma center than level 1. It means that we have the expertise, the team, all of the equipment that we need to serve a wide variety of patients throughout the Northland.
Where is the other nearest level 1 trauma centers?
Our catchment area extends from the Upper Peninsula of Michigan all the way across the entire Northland over the Dakotas up to Canada. So we are really privileged to care for people from all over. That's a larger catchment area than most level 1 trauma centers have, and we are the only level 1 trauma center that's north of the cities.
So when a patient comes to the emergency room, they don't know where they're going to end up in here. How do we make sure that everybody gets to the right spot?
The emergency control desk coordinators make sure that the physicians, the nurses, and the triage nurse, ambulance, police get to where they need and do what they need to do. When the patient is seen, the orders go in, or we put the order in. We make sure everything runs smoothly, all the tests are done in a timely manner, and everything runs smooth so the doctors and the nurses can provide the best care.
Do I get a different area if I come in with a heart attack than I may if I come in with an earache?
Yes.
How do we do that?
That is done through triage, and it's determined what room to go to by the charge nurse.
Can you tell me about some of the special features that this may have for some of our special patients?
We have behavioral health area, we have pediatric area, we have ortho, anything. We're a level 1 trauma center, so we take care of all areas.
Okay, so it's not all the same space for everybody. It's an area that's appropriate for their care that allows them to start to heal the minute they get here.
Yes.
Perfect.
Correct.
This all started out on a piece of paper with design. What type of input did we have for the design of this space to care for our patients?
We had lots of patient feedback, lots of years of experience with how to help patients best. So we care for patients if they're having a splinter, if they're having a heart attack, if they're having a behavioral health emergency. And based on our experience caring for those kinds of patients and the feedback that we've received from them over the years, we've created a space here that will allow us to care for each of those kinds of patients in a unique way.
How about input from our staff? Did the staff participate in designing where stuff stayed and went in this?
Staff has been very involved in the process, yeah.
You think they're going to be excited to be in here?
I can't wait to come to this new space. This space is beautiful.
It's beautiful.
And it's really going to be amazing to help our patients in such a beautifully designed space.
I love the intentional design. All the way from the trauma rooms to behavioral health. Everything has enough space, I believe, and is going to be navigable. It's just going to be well suited for the patients we serve.
One of the things we talked about earlier was that people are generally having a bad day
Yeah.
when you end up in the emergency room, but this should be the spot where the day starts to get better.
Right, yeah. Hopefully we can turn their day around.
That's exactly right. I want to thank all of our ED colleagues here for walking me around and showing me some of the great features of this. We're very, very excited about this. This means a lot to our patients, a lot to our communities, but certainly a lot to our staff to provide this type of care in this type of area. I want to thank you for the time that you took to design this and the time that you spent with me today, walking us through this and showing the difference that it's going to make, the healthy difference that it's going to make in our patients' lives. Thank you.